What's happening, Xogos Nation? This is Zach Edwards with another episode of the Xogos Gaming Series. This is where we go through all of our games. We might do repeats and go further into the game than we did before. So it's not just part one, it's part two, part three, part infinite amount of numbers because we're constantly building on it. And anytime we come up with a new fact or change to it or new development, new functions in the game, we're going to be showing you that. Now, I'm hoping that we will release the first class. I know I talked about it last week, but I was actually told to hold off because the person that's going to be helping us with that wants a little bit more time to work through it. So I've held off on the cooking class. But this time it's either going to be the business building game or business building program class, or it's going to be the fashion design class, or it's going to be the game design class. It's going to be, what are the other ones that we have coming up? Documentaries, filmmaking, storytelling. All these are classes with a interactive portion to it. So you're not just learning about it. You're just not reading about it, but you're actually going to be part of the production crew. And you can also, with some of them, we have a magazine design program where you're going to actually be teamed up with others. Like you can actually find other people to join on, and you can design your own magazine, and we'll actually help you to distribute it as well. And for what? How much are we asking you? Nothing. That's right. All it is the subscription to Xogos Gaming. Now, again, there may be in the future where you have to pay a coin or two or three. We have to make it like valuable or a sense of value because that's what brings people back in. But all of these systems, all these classes, you're going to be able to share things with the world. You're going to be able to produce your first story, your first documentary, your first, if you're going to be want to be a journalist, your first articles, and we will publish them ourselves. At some point, we will also be a book publisher. We publish our own books, but we haven't actually reached out to produce other people's books as of yet, but we will soon. So with all that being said, I appreciate your time and your coming back every day to learn a little bit more. Again, we post these almost every day. Now, just a full disclosure, last week I was out on a hunt and so was not able to go out and bring this up. So I did not release some of the videos late last week. But the intention is to actually do it every single day. So you can see more games, more programs, more classes, everything we have in our system. If you want to see more about the scholarship, put them in the comments below so I know. Talk about the scholarships. Talk about X, Y, or Z based on what you want. So, all that being said, we're already a few minutes into this. Let's get into the actual game that we're talking about today. So today I thought we would do, now this being said, we're going to show you a game, but it's actually being reviewed right now by actual doctors, chiropractors, nurses, anesthetists, all those different specialists. Now they're going to be going through it to basically tell us what they like, what they don't like, what we need to change and such. Not on the game side, but on the actual factual side, because we want you to be able to diagnose people. This is why it's called medical diagnosis. Right here, diagnosis. This is your general hospital of your city. So this is medical diagnosis, the game. So first off, you start off with Nurse Sarah. Now she already knows who you are. She'll actually call you by name. And you go through this introduction, which I am not going to go through. I'm going to let you read that. Okay, but in this game, the first thing you do is you start off with different types of medicine. And actually, you know what, hold off. We're going to show you something else first. I'm going to show you the advancements that you can do. Starting off, you always start off with the patient's care. I highly recommend you stay with the patient's care because you don't know, if you're just new to this program, you don't know all the ins and outs of how to diagnose a patient. You haven't been through the system, so start with the easiest ones possible. In patient care, you take care of one patient at a time. This is usually a doctor's office or something like that. That's when you're going to have a one-on-one talk with a patient. The next one is the emergency room. So it's a little more high-paced, but it's all, or fast-paced, but it's also where you're working with 6 different patients at the same time. Now, you might not actually accept 6 patients. You might accept 3 patients, but you have the possibility of going up to 6 patients and working on each of them all at the same time. You go in, you find out some information, you leave, you send in tests, and you go to the next person. While those tests are being done, you're working with the other person, and on and on and on until it's complete. These are the 2 easiest levels. You have free access to them. But in order to come up to here, you have to have up to 10,000 XP. Why? Because this is the rare case unit. Rare case, I don't know if you've ever seen it, your parents might have. There's a TV series called House. It's where this one person and his team are responsible with finding the rare cases of medical issues. And so they go through basically a doctor, normal doctor say, I don't know, or I don't want this patient because he has X, Y, or Z, or I've worked with this patient, I don't know what's wrong with him, I need help. That's the rare case unit. If you get to that point, you're pretty darn good. And if you get to that point, you can pretty much diagnose most things. But this is, again, locked until you get to 10,000 XP. Now, XP you do not spend. You actually spend money, currency, dollars. These are the earnings that you make from your patients. And you can buy things like manuals, AI assistants, those type of things. And there'll be more things you can buy with them as you go. These are not Xogos coins, so they do not apply to the Xogos coin system. Yeah, right. So the Xogos coin system is usually 1 or 2 or 3 coins that you earn each time. This would be like 600. Definitely not coins. Okay, so moving on. I'm going to pick patient care. I'm going to go back through the intro, and I'm going to pick, again, the simplest cases, which will be general medicine. This is where you want to begin. You want to be able to understand how to do it and get a little bit of, wind under your wings as you take off. Now, you have general medicine, which is basically common conditions, routine cases, those type of things. Then you have the internal medicine. Now, this is moderate complexity, so not that bad. We only have 20 cases here. Or you can go to acute. Now, as you see, it's getting more complex, more serious. Acute care, 25 patients are waiting for you in there. And then you have critical care, which is 13 patients. These ones are very complex and life-threatening. Now, if you cannot do this, I would not suggest you going to the rare case unit. Though in all of them, you actually have help, except for the rare case unit. But you do have your manuals that you might buy. And then you have randomized patients. If you just want to see whichever patients need your help, great, you could do that. It's more of a challenge because you don't know what you're going to get, but always start off with the easiest and go forward. So I'm going to start here. Now, I've already gone through these. Normally, you would actually see the tutorial. And again, if you want to see the tutorial, you can come up here and go to hit the button that says tutorial. Say you've already watched the tutorial and you want a refresher. Now, in here, you have the patient. This one is a female patient, 29 years old. She's in toxicology. So that's the office that she's in. Let's see. A 29-year-old woman, or female, sorry, arrives at the emergency department. The triage nurse, meaning the first nurse that comes in and talks to her, reports that the chief complaint is respiratory depression. The patient appears quite distressed and uncomfortable. Okay, so the first thing you almost always want to do, always, is check their vitals. It'll tell you small things that might be questionable to you. So when you come in here, you go to blood pressure. Their blood pressure is a little heightened, though it's still within range. Heart rate, 75. That's completely normal, middle ground. As you can see, there are numbers to tell you at that age what their rate should be. Temperature, normal, don't have a fever. Respiratory, 16 breaths per minute. It's usually 12 to 20, so yeah. And SpO2, which is basically the count of oxygen in your blood. And that's at 98%. It should be between 95 and 100. Chief complaint was respiratory depression. Now, I don't know exactly what that means. So I could go look at my manual, but I'm going to keep going. Started yesterday evening. Good. So it's not a long set problem. Now, here's the thing. Associated symptoms. You'll actually see these. The nurse will find these before you meet with them, or you will find them by doing a vital check. checking the ears, those type of things. Okay, it says pinpoint pupils, very small pupils, altered mental status. Okay, and then it comes down here, patient reports, classic triad, uh, altered mental status, respiratory depression, and pinpoint pupils. Triage 3. So let's go into the assessment. Now it asks, do you want to find out more about their family history, which that's a good one to go to. You can only pick one of the two. So we're not giving you everything. We're just going to give you most things. But I think there's something to do with, it just started yesterday. I'm not thinking that it's in their genetics. I'm thinking that it's more social. Office work. That's what she does. Lives with spouse. Reports moderate work stress. I was wrong. Okay. Continue assessment. Now, it also says review all findings. One more physical exam check. Okay. Here we go. So this is assessment, physical exam checks. General appearance. Patient appears acutely ill and uncomfortable. Notable findings. We already read that. Notable findings. Track marks and evidence of drug use. Oh, there's a big one. Hey, I'm glad I did this one. This one last assessment. Notable findings. So I want to check their bloodstream. So I'm going to give them a blood test. Response to naloxone, confirmed diagnosis. Naloxone. I don't know what that is. I need to look that up. Okay. So in here, now we're finding the diagnosis stage. So it goes through some of the symptoms, known symptoms. Toxicology. Again, toxins. That could be anything from a snake bite to alcohol. So let's go through it. Complete blood count. That'd probably be good. Basic metabolic panel. Now, what does that mean? Let's go through. Glucose, sodium, potassium, chloride, carbon dioxide, BUN, creatinine, and calcium. So this will basically evaluate the kidney function, electrolyte imbalance, diabetes, dehydration, medication mentoring. Okay. This charges $300 to the patient. Let's do it. Within normal levels. Okay, so let's go to complete blood count. This would tell us detects infection, anemia, bleeding or disorder, leukemia, monitors chemotherapy effects. So chemotherapy, not that. So it's not really the one I want, but you know what? Nope, normal letters. Ugh. Oh, see, I should have gone to the urine analysis. Okay, that's going to basically tell us that there's drugs in her system. Diagnosis is UTIs, which is a urinary tract infection, basically an infection within the places you go to the bathroom. Kidney disease, diabetes, detects drug use. That should have been the first one I went to. And pregnancy test. And I scroll down. Within normal levels. Criminy Christmas. What the heck? Those were all the recommended lab results. Okay, so vital signs, no. Physical examination, no. Mental health, no. Family history, social. So we did the family history, or we didn't do the family history because we went to the social. It might be time to do the family history. Assesses risks in hereditary disorders and such. It's only $100 for the patient. Golly. Again, normal levels. Okay, so what am I getting wrong? It sounded like some sort of drug use. Because she had tracks, remember? Tracks for drug use. So let's go to basic labs. Okay, this one is strep throat, COVID, mono. No. Advanced. Troponin, diagnosis heart attack, chest pains, risk, no. Let's see, something, glucose. Sorry, hemoglobin, globin, hemoglobin. That's for diabetes. Liquid panel, how about that? Screening for heart disease risk, monitoring cholesterol, medication effects, assessing liquid. You know what? That might be one, and it's low cost. Let's try that one. Normal again. Holy cow. Imaging. I don't think we need a chest or x-ray or anything like that. She doesn't have anything broken. EKG would actually tell us if their heart rates. An EKG is the evaluation chest pain, palpitations, shortness of breath, diagnosed heart attack. No, that doesn't have anything to do with what she's going through. Pelvis ultrasound, mammogram. No, we had those liquids. She's not pregnant. Advanced imaging. It's all CT scans. They're doing scans on the head, pulmonary, MRI, spine. No, she doesn't have any of those things. Procedures. Polysomnographic, whatever that is. Diagnose sleep apnea. She didn't say anything like that. Daytime sleepiness. No. Genetics. Multi-gene panel. Maybe hereditary cancer risk. Conditions, family planning. Okay, this is the first one I've ever played that with. I'm stumped. I usually get it at some point because I don't usually have normal. I need some help. Let's ask Dr. Chen. Dr. Chen will basically take half of my earnings. So if I ask him for help, my patient might be $900. He's going to take $450. Here it's $470 because it's $940 of all the tests that I have racked up, sadly. So I'm going to ask Dr. Chen. Dr. Chen then walks me through. I have to make my agreement. Yes, I will pay you half my earnings. Hello, Dr. Chen. They're going to walk through basically who he is. It's going to teach you what to do. Now, looking at this patient, their main complaint is respiratory depression. What body system do you think this primary affects? Respiratory, breathing, depression. Okay, toxicology, gastrointestinal, so the stomach, the gastro being the digestive system, muscular skeleton, not that. Let's go toxicology. Exactly right. Okay. The patient shows some symptoms, respiratory depression, pinpoint pupil, altered mental state, which I thought drugs. These symptoms are connected. Yes, I would say they were connected. These ones are not related. Let's go with connected. Good thinking. Okay, next one. In toxicology conditions, we look for specific red flag symptoms that point to serious conditions. Which of these in the key findings that helped narrow down the diagnosis? Classic triad. Okay, so that's mental state and respiratory and such. Track marks and evidence of drug use. Yeah. So which of these key findings that helps narrow down their diagnosis? I'd actually say the track marks, but and then the other one is response to oxone confirmed diagnosis. Now probably not. I don't know what that one is. They said this one twice, so I'm going to go with that one. Excellent. This is a critical finding. Now, for the patient with the symptoms, which test category is most important? I'm looking, lab tests would probably be the most important, but possibly urine tests. Cardiac markers? Not really. So let's go with drugs, lab tests, or urine. Let's go with urine first. Nope. That could help, but it's more specific to test this. Okay, fine. Yes. Can I click on it? Laboratory? Okay. Test point. Okay, so benzodiazepine, OD. See, it says normal pupils, less respiratory depression, organophosphate sludge symptoms, and hypoglycemia. Check glucose, which I think we did. Stroke equals focal deficient. So if they had a stroke, let's keep going. Based on everything we've seen, what condition should be on our differential? Clinical reasoning, opioid toxicity. I did a blood test. Okay. CNS depression, respiratory depression. Now, most of the time when you get a big word, it should actually define it for you. You can click on it and you can see the definition. I'm going to have to work on adding more of those to this program. So it just basically says that it's the symptoms. I'll let you read through all of them. So there you go. Opioid toxidrome. What I basically do is usually copy that. There you go. Opioid overdose. See, I was saying that from the beginning. Which test looked at that better? I guess it should have been more lab tests. Maybe I've missed a lab that would have been good. Return to case. Now we already know because he helped us find it. Suggest diagnosis. Boom. Okay, so even though I didn't get the full $900 that we would have charged him, I got half of it. Dr. Chen got the other half. This is excellent reasoning. Opioid toxidrome, CNS depression. Basically, they read the same thing, but it says this: recommended treatment, ABCs first, naloxone, 0.4 to 2 milligrams, and such in an IV. Repeat every 3 minutes until responsive. Bag mask ventilation. Consider intubation, which means they basically feed you oxygen. Observe for resedation. So they might have to resedate them. And then you continue the next one. Okay, so this was a little bit more difficult than I've had in the past. But it was good to know I had a Dr. Chen there. I should have actually said opioid, or I would have said drug overdose. But opioid would have been more reasonable, especially because we knew the tracks. She showed tracks. Now, again, I said the triad. The triad was the most significant piece of evidence, but truthfully, those tracks would have been fairly evident too. But then it goes to the next patient, and you get to work with many different patients and see what different things that they're going through. There you go. You're basically being a nurse or a doctor. Oh, actually, you're being a resident doctor, which means you're coming in as a student after you've graduated from med school, going in for a basically internship inside the hospital where you're not paid as much as a doctor, but you're working towards becoming a doctor. So I hope you enjoyed this. It's an interesting game. If you like medical, if you want to learn more, please try it out. Go to the marketplace. Let's see. Let's go home. Come up here. Up, handbook. You can't buy it yet. We don't have enough money. No, we don't have a handbook yet. So we should be able to go to the marketplace, the shop. There's where the shop is. And buy the basic conditions handbook. Done deal. I own it now. I'm also buying the advanced conditions handbook. And next time I'll go, actually, I got the money too. I've been saving up. AI diagnosis assistant. Now here's the funny thing. Now that I have that, I don't need Dr. Chen. Or at least I won't need it as much. And I won't have to pay him. I'll be able to collect the whole thing. And it can walk me through each of the steps. So thanks so much for joining us on this game design or game tutorial series. We will talk to you next time. And I hope to bring up one of our new games, either our investing game or such. I'll let you know. Thanks so much. Talk to you soon. Bye.